Hello, everybody.
Good morning, everyone. We'll wait for just a minute while everyone onboards, and then we'll start the session. Thank you for joining us today. If you would like, you can introduce each other in the chat. All participants are muted right now, so you're welcome to please introduce each other in the chat. I am going to go ahead and get started with welcoming you all today. I want to welcome everyone to TEA's 2023 Mental and Behavioral Health webinar series. On behalf of the agency, we are glad you took this hour out of your day to join us. Now, today's webinar, the first in a series of 6, is hosted by TEA's mental health and wellness team members. Tammy Genke, you see her on the screen. She's the state coordinator for our Project Aware Texas collaborative mental health project we work on with several agencies across the state, including HHSC, the University of Texas at Austin, and others. Also with us is Ashton Millett. He is the mental health and education specialist at TEA. And I am Julie Wayman. I serve as the director of mental and behavioral health coordination here at TEA. And we all work in a division called the Supported Schools Division on school mental health and safety issues at TEA. So we initiated this webinar series as a follow-up to the 6th annual Advancing Behavioral Health Collaboration Summit. Many of you attended that last fall in November and December for 3 days. We initiated it at the request to continue learning and taking a deeper dive into many of the topics and the resources that were shared there by the panelists. So we've decided to convene this hour, put it on our calendar, and hold it for the second Wednesday of each month, where we can convene around mental health topics, resources, including information on substance abuse and substance use awareness, fentanyl awareness that we're working on statewide, and others to deal with current and relevant topics. So today we'll focus on how HHSC substance use and abuse resources can support the education system in our work. We'll talk more about this and provide introductions to our panelists shortly. So it looks like many people have onboarded while I've kind of been welcoming you, and I see some more people are onboarding. But let's kick off this first webinar series now for the new year for continuous learning together. All right, so let me just say that I want to start with just a bit of housekeeping before we introduce our speakers and get started. Now we're hosting this in Zoom, a webinar format. And that means that as participants, you can't use your video or share audio like you can in a Zoom meeting. So what we want to be able to do then is to become familiar that we'll use the Q&A feature, that function at the bottom of your screen, when you have questions for TEA or the panelists to be answered. And we'll do our best to answer those. So then we want you to become familiar with your chat function too. I know by now we're familiar with chat, but that's where you can talk with each other. You can say hello and that kind of thing in the chat. So feel free to use that along the hour as you would. Also feel free to leave us any comments or share with each other any resources that you would like to share. So ready to go. And we want to let you know one thing. As everybody seems to be onboarding, the participants have stabilized. I want to share this. We are at Project Aware at TEA. Have a funding source at the agency that the University of Texas takes care of our pre and post test surveys. And what we are required to do for the Substance Abuse and Mental Health Administration is to make sure that our resources are providing you with some information. So if you could do this quick survey that the funder is requiring, we would appreciate your support with this requirement. So how you do this is you can access it with your camera on your smartphone, take a picture of that QR code, and you'll just have a few questions that pop up, real simple. And then you can do it from your computer by using the link in your browser. So either way, and you put Prevention Resource Center. That'll be the code word we'll use for the topic for this survey. We're going to use a code word, Prevention Resource Center, because that's a big resource that we want to make sure you're all aware of at the end of this topic. So we made that up for the code word. That's what you put in. And let's just take quiet 2 minutes for everyone to do their real quick pre-test for SAMHSA. And then it's really not a test, it's kind of a survey. And then what we're going to do is move on. So you can just relax for a second if you have your pre-survey done already. Get a drink of water, take a deep breath, and just get our mind space into the mood to talk about mental and behavioral health. We so much appreciate all you out in the schools and in the communities and the partners who are here today wanting to take a deeper dive into this topic. I believe Ashton also dropped a link into the chat if you need to access the link for the pre-test survey real quickly. And I'll just sit here and take a little breath myself just for a minute. You can keep typing hello to each other in the chat too. All right, I hope everyone's got the link. And without further ado, we're going to move on to the next slide. And I'm going to say thank you for completing the brief survey. Just a few other links as opening that we want to make sure that you have. If we could put the slide deck back up there on the welcome. If we could register, we just want to share links. Ashton will drop them. If you want to register for any further survey, of these series of the webinars on the second Wednesday, we're providing you with a link so you can bookmark that and register later. Just a little more housekeeping here. And today's webinar will be recorded. We wanted to let you know. So if you want to share it later with additional people, school counselors, others on your student support teams that you work with, your safe and supported school program teams, the link will be posted on the school mental health chat. Ashton is dropping that link in where the recordings will be posted after the session. And then I want to share some good news with you. We will be offering CPU credits for educators for this 1-hour webinar today. If you attend the entire webinar, a series of CPE certificate will be sent tomorrow to the email address that you registered with. Now, this is the only way to get your certificate is to stay on through the webinar, and we've got your email. It's totally separate from the surveys that anonymously go over to UT. So what we want you to do is stay on. We'll give you a CPE, and we'll give you one for every session that you attend. We think professional development is important, and we want to reinforce that even for this hour of your time that you've taken out today. Finally, you can subscribe to our newsletter to get more information on mental and behavioral health and other TEA topics as you choose. It's good to have information coming in all the time on resources, so click to that newsletter and sign up if you're not already on our newsletter. We're going to be really sharing a lot of safety and mental health information through that newsletter this year on mental. It's called TEA Mental and Behavioral Health. Okay, without further ado, we're 10 minutes in, and I'm going to turn it over now to my colleague, Tammy Genke, to introduce our session for today and introduce you to our speakers. Tammy? Did we lose Tammy?
We did lose Tammy, but I do not mind stepping in really quickly to introduce our speakers. So again, welcome everyone. It's definitely really great and amazing to have so many people online today for our webinar event. Today we'll be learning more from the Health and Human Services Commission on how HHSC's substance use prevention resources can enhance our public education system. And without further ado, I will introduce our speakers for today. First, we have Claire Jameson, who is currently the manager of the Promotions and Public Awareness team within the Prevention and Behavioral Health Unit at the Health and Human Services Commission. And as well as her colleague, Dr. Sachin Campbell, who is currently a program specialist at the Texas Health and Human Services Commission, serving as the Community Development and Training Specialist. Both of our presenters have extensive education experience in the areas of public health and community development and prevention throughout the state. And before I turn things over to our presenters, I do want to remind us that you can use the Q&A function below to ask questions to the presenters. Many of your questions may be answered throughout the session and on the slides as well, but definitely feel free to use the Q&A function as need be throughout the presentation. And without further ado, I will give it over to Claire and Dr. Sachin. Claire, you can feel free to share your screen now.
Hey everybody, I'm just gonna wait till Claire shares the screen. Okay, great. Can you all hear me? Okay, great. Hi everybody. I want to first thank the folks at the Texas Education Agency for inviting us for this webinar series. I also want to thank my amazing team. I work with the most incredible people on the planet, and it's a joy to come to work every morning. I'm really excited for the next hour because I feel like this is going to be beneficial for everybody listening, for the simple fact that you are all the perfect audience. Many listening are educators, administrators, counselors who work in the schools. Many of you may not know what we do here on the Prevention and Behavioral Health Promotions team here at the state, and what our providers that we fund do at the state. We are from the Texas Health and Human Services Commission, specifically the Prevention and Behavioral Health Promotions team, housed in the Mental Health and Substance Use Programs Unit. So today we'll be discussing what we do here at the state. I will be joined by my colleague and manager, Claire, who will speak a little bit later on our statewide media campaign. So you will hear from her at some further point. Next slide, please. Okay, so prevention and behavioral health promotion. We basically seek to promote behavioral health and reduce use of the following substances: underage alcohol, marijuana and cannabinoid, tobacco and nicotine products, prescription drugs. I did want to say that here at the state, we have many teams. We have a TTOR team. They're the Texas Targeted Opioid Response Team. They're dealing a lot with fentanyl. We have a Substance Intervention Treatment Programs team. They deal with more treatment intervention initiatives. So I say that because there's a lot of moving pieces here at the state, and we try to collaborate and leverage resources when needed. Now, you'll see on this PowerPoint, on the slide, it says there that we're funded by the Substance Abuse Prevention and Treatment Block Grant. Actually, they actually changed the name of this block grant. They actually replaced the word abuse with use and added recovery services. So now it's moving forward, it's the block grant for substance use prevention, treatment, and recovery services. We here call it block grant for short. And we're required to have 20% of our funds go towards prevention. Next slide, please. So historically, Texas has been focused on targeting risk factors that occur at the individual level. By that, I mean, working on, if they have low self-esteem or low self-efficacy. We look at the relationship level, peer parental use, approval of substances. So you'll see here this list emphasizing the importance of making good choices, teaching youth refusal skills, positive coping skills, teaching parents how to talk to their kids about drugs and alcohol. This is an okay list. There's nothing wrong with this list. I mean, personally, I'm not a parent, but if I had a kid, I would be, talking to my kids about presenting about the harms of drug and alcohol use. So this is a good list. However, if you look at it, it's mainly it's more individualized. Here at the state, we always want to make a bigger impact. So like I said, there's nothing wrong with this list. And a lot of our providers, a lot of the work we do is at the individual level, but we wanted to take a more upstream approach. Next slide, please. So I'm sure a lot of you have seen this graphic before, but I'm going to go over it in case you have not. I love this analogy. Imagine if you're walking along a stream. Let's say you're downstream and you're hanging out at the bank and you're just hanging out there and you're noticing people toward the upstream, they fall into the river and they're being pushed by a current downstream and they start to drown. You start to jump into the stream and help these people when you're downstream. So you're saving people when they reach at the downstream. They're nearly drowning. You're making an attempt to prevent folks from drowning, which is great. I mean, it's great. You're saving lives. However, you start to get tired. You start to notice more and more people at the upstream start to fall into the river, and they're pushed by the currents and they continue to float downstream and nearly drown. Jumping in the river downstream is fine. Saving lives is fine. However, you think to yourself, if I tackle problems upstream, like maybe we can build a fence upstream and prevent people from falling into the river in the first place. I kind of think of this like our healthcare system. You may have a lot of folks who visit the ERs. Like, let's say you have a lot of folks who, you live in a community and a lot of folks ingest a lot of sugar, right? They get hyperglycemia, they become dizzy, they fall, they get sent to the ER. The ER helps them out. Sure, the ER is doing a good job. It's clinical care, it's more of a downstream approach. But if you look at the bigger picture, why are people in the first place consuming excess sugar? Maybe we could look at tackling this issue upstream. Maybe we could run a diabetes campaign, look at certain media upstream and prevent ER visits in the first place. So I like this graphic because it kind of centers us in letting you all know that we're adopting more and more an upstream approach. Next slide, please. So this slide, I really like this slide because it kind of tells you the frameworks and models that we use on a daily basis. And when I say we, I mean us at the state and providers. And when I use the term providers, I'm referring to organizations that we fund to implement, to deliver prevention into the field. We can spend hours on this slide. So I'm going to touch on bits and pieces of this because I do think this is important to know for context, because we're going to be talking a lot about this in other slides as we go further. But you'll see on the slide, socio-ecological model. Here, we're talking about the interplay between the individual, relationship, community, and societal factors. You'll see strategic prevention framework. So SAMHSA developed what we call the SPF model. It's basically, there's 5 steps in this model. There's an assessment. That's where you identify prevention needs based on data. There's building capacity, where you're looking at your local resources. You know, how do we address prevention needs? What do we have to work with, right? There's a planning stage where we look at, a plan. What works to address prevention needs? How do we do this well? What do we need to do and how should we do it, right? There's an implementation stage where we're looking to deliver evidence-based programs and practices as intended. How can you put your plan into action? And there's an evaluation phase where you're looking at, the outcomes. Is this working? Is your plan succeeding? And during this SPF, the stages, there's 2 themes, overarching themes involved in every step, which is cultural competency and sustainability. We want to make sure we keep that in mind. The Center for Substance Abuse Prevention Strategies, or CSAP strategies, is really important because we and I will give you examples later in this presentation. But there's many components involved into this, the CSAP strategies. The first is information dissemination. That's where we increase knowledge and changes attitudes towards communication that are mainly one way. So think of education presentations. For instance, we give presentations related to our 4 prevention priorities that you've seen in a previous slide. We give presentations around substance use, misuse prevention, behavioral health promotion, or media. Media awareness can be a form of information dissemination. It's kind of a one-way channel. I know with our providers that I mentioned earlier, we have a lot of providers that go into schools and they give presentations. For example, we have some providers that will give presentations on the dangers of vaping. For example, we have a provider from the Council on Alcohol and Drug Abuse, Coastal Bend, that conducted a number of tobacco and e-cigarette and opioid presentations with youth and adults in Corpus Christi ISD. So that's just one example of what providers do. They go into the schools, they give presentations involving information dissemination. Prevention education is another CSAP strategy. That's basically where it's, think of a two-way communication between the educator and participants. So think of classroom education services, and we're going to talk a lot about this with examples in a slide coming up. So I'm going to hold off on that for right now. We have positive alternatives. That's another CSAP strategy. Positive alternatives provide fun, challenging, structured activities with supervision so people have constructive and healthy ways to enjoy free time and learn skills. I'm also going to give examples in a future slide about this. There's problem ID and referral. Basically, we're looking at determining the needs of participants and seeing if they require additional education or intensive services and strategies outside the scope of prevention. Examples of services to which participants and their families may be referred to are food banks, resource assistance programs. We have regional OSARs. OSARs are outreach, screening, assessment, and referral services. It's important to make sure if we can't handle it, we can refer folks to people who can. There's community-based processes. That's another CSAP strategy. That's where we look to strengthen resources, such as community coalitions to prevent substance use and misuse. And we'll touch on that in a later slide. Environmental and environmental social policies is the final CSAP strategy, and it's aimed at settings and conditions in which people live, work, and socialize. Here we're looking at changing policies, social norm, environmental conditions, practices, and behaviors to reduce risk factors and increase protective factors. We have a lot of providers who work in this space. I know there's been a lot of coalitions that have helped pass Tobacco 21. Some of you all have heard about Tobacco 21. That's where we raised the smoking age from 18 to 21. Others have passed smoke-free ordinances, basically policies that make our communities safer. Next slide, please. Okay, so our programs and our projects. We are involved in a lot of initiatives here at the state, and we're gonna go over each one of these that are listed. The only one that we're not gonna have time to talk about, but I did want the audience to be aware of, is our SINAR program, because I feel like it's really, really important to our community, just the field of public health. So SINAR is basically a program responsible for implementing the requirements of the SINAR Amendment. The SINAR Amendment is a federal mandate which tasks us to conduct a yearly survey where random inspections at tobacco retailers are conducted using minor decoys to see if retailers are selling tobacco products to anybody under 21. So in a way, we're keeping tobacco retailers in check and making sure that they're not selling harmful products to anyone under 21. If a retailer sells to somebody under 21, that's a retail violation. And a retail violation rate is determined from this survey, and we're trying to keep this number under 20%. The PRCs, the Prevention Resource Centers, play a big part in this, which we'll talk about later. So let's talk about each of our programs here at the state. Next slide. So our youth programs, our YP programs. Now this, I know a lot of the audience here work in schools. Our youth prevention programs provide services in 187 of the 250 counties in Texas. This is where, and we'll talk about this in the next slide, where we deliver, where our prevention providers go into schools and deliver certain curriculum. But I did want to explain our populations of focus. Some of you all may know this already. We have our universal population, or our youth prevention universal, where we focus on the general population without consideration of individual differences and risk of substance use or misuse. So basically anybody. Our YPS, or selected population, focuses on subgroups from the general population that are determined to be at risk for substance use misuse. And our YPI focus on people in high-risk environments who are minimal yet detectable signs or symptoms of misuse. Next slide, please. So remember the CSAP strategy that I mentioned earlier, prevention education or education, how it's described as basically a two-way communication between the educator and the participant, like classroom education services. So think of our YP programs using this prevention education strategy. So basically our providers that we fund go into the schools and they deliver what we call YP curriculum. And here's a list of YP curriculum. Here you see All-Stars, Project Towards No Drug Abuse, Positive Action. So these are individual curriculum that all have, they're basically evidence-based practices, best practices that are being used at these schools. So essentially what happens is you have our providers go into these schools and help deliver these curriculum. These curriculum, and you can look this up on there. They all have websites where you can read more about specifically what the lesson plans are and what each curriculum involves. But our providers do go into the schools and deliver this every year. And we have many examples. For instance, we have Santa Maria Hostel in Region 6, which covers Houston, where they go to Coop Elementary School, where they deliver curriculum. We're always looking for providers to deliver curriculum into the schools. I am noticing more and more of our providers are conducting stress relieving and trauma healing activities at schools. For instance, Longview Well Center in Region 4 had some activities at the start of the school year to help students adjust back to the school schedule and feel confident about the new academic year. I think this is really important to mention because, as you know, in this past couple of years, we had a lot of stressors. We had COVID, we had a winter storm Uri, we had global events. I think there's a lot of stressors that are affecting the youth. And, you know, as far as COVID is concerned, it's not as bad as it was in previous years with the schools closing and the rates, but it's still around. And I did want to say that there are long-term effects from COVID, lower test scores, effects regarding like their behavioral health, like, you know, increase in anxiety. Some may turn to substances. So we'll be dealing with COVID effects for many years to come. So I did also want to mention that. Next slide, please. We have community coalition partnerships, or CCPs, where basically CCPs are basically collaborative partnerships of people and or organizations that strive to address one or more of the state's 4 prevention priorities and community behavioral health more broadly. They look at the CSAP model that we covered earlier to basically mobilize and engage communities to implement promising evidence-based environmental strategies with a primary focus to change policies and influence social norms related to substance use. I did want to say that a lot of these coalitions, you know, they want to be represented. They work with what we call the 12 sectors. So their representation is made up of the 12 sectors of engagement. And when I say 12 sectors, they include youth, parents, business, law enforcement. So it's important to point that out because when we deal with coalitions, we want to think of the community, right? And at the end of the day, I think coalitions are important because they want to create safer and healthier communities. That's the main objective, right? So one of the examples is working with local municipalities to pass a smoke-free ordinance. Coalitions are vital because they're essential to our community and they have the community in their mind in everything they do. So I did want to point that out. I did want to also add So our organization, specifically our team, is allocating additional funding to expand our CCP work and focus on improving health equity for communities disproportionately impacted by COVID. And we call it the CCP COVID project. These CCPs will engage in community-based processes to enhance environmental conditions and provide alternate activities in order to have a broad-reaching and long-lasting positive impact. One of our goals is by March of this year, we want to implement community activities and projects that enhance behavioral health and wellness. And you'll see at the end of this presentation, we actually have numbers to show some of the results of some of our initiatives. I did want to go to the next slide, please. So this is the PRCs or the Prevention Resource Centers. I did want to inform y'all real quick. I wanted to show this map here. So basically, I know there's education service centers, there's LMHAs, they're divided in different regions. We have HHSC or HHS, Health and Human Services regions as well. And there are 11 in the state. So our prevention resource centers, we have 11 of them, and they're based in, so that's one in each region, basically. And PRCs are here to enhance basically community collaboration. Next slide, please. Our PRCs essentially have four main functions. We have a data core, which maintains and serves as a resource for substance use and related behavioral health data for the region. We have data coordinators at our PRCs that work on a regional needs assessment to provide organizations and stakeholders with region-specific substance use behavioral health information. They create an RNA, a regional needs assessment, which is posted on their website for anybody to access. So I do encourage y'all to look up your local prevention resource center and read this regional needs assessment. We have a training core focused on building the prevention workforce through technical support and coordination of prevention trainings. We have a media core, which Claire's going to talk about in a second, which increases communities' understanding on substance use and misuse to promote behavioral health. And we have a tobacco core that helps us with providing education and monitoring activities that address retailer compliance with state law and affecting monitors access to tobacco and other nicotine products. And as you remember, I mentioned the Signer Amendment. The tobacco coordinators play a big role in the Signer Amendment, because at the end of the day, we want to prevent access to these products from youth. So now I'm going to turn it over to Claire, who is going to talk a little bit about our statewide media campaign.
Thank you, Sachin. I'm excited to be here. Like Sachin said, I'm going to talk about our statewide media campaign. Before I kind of jump into the statewide media campaign and the goals of this year's statewide media campaign, I wanted to give some background. So PBHP has been doing, and HHSC in general has been doing a media campaign focused on youth for over 20 years. We in the past have really focused on individual choices relating to substance use and used, similar messages to don't do drugs, drugs are bad, really focusing on youth and parents and individual choice. To kind of be in line with our change that Tashin described earlier of going more upstream, we're really looking to focus this media campaign on addressing the upstream risk factors, that shape individual choice around substance use. And so specifically for this year's media campaign, we were able to add additional funds due to the HR 133 and American Rescue Plan. So those are both aimed at, reducing the issues caused by COVID. I know earlier Sachin mentioned that there's just been an increase in substance use. I know we've had an increase in suicide attempts. It's been a rough couple of years. And so we're really this year with our media campaign and most likely next year, focusing on, yes, addressing the risk factors that cause substance use, but also helping to really help Texans recover from everything that happened with COVID. So we also want to identify long-term engagement strategies to increase the awareness and involvement in promoting behavioral health and wellness. And really, we're hoping that will reduce substance use in the future. So this first slide kind of shows that all of our providers that Sachin mentioned, the YPs, the youth programs, the prevention resource centers, and the community coalition partnerships are required to participate in the media campaign. We provide them content, they share it in their community, and they share it on social. We also right now are working with 2 vendors. We're working with the UT Center for Health Communication and Fleischman Hillard. They are working on, the research and the creative concepts for us. So our 2 goals for this media campaign are to provide Texas youth, young adults, and parents and guardians with resources to cope with trauma, stress, and anxiety, mostly caused by COVID, but also just in general. And the second goal is to inform Texas community leaders about the risk and protective factors that contribute to substance use disorders, So our target audience for this campaign is parents of youth as individuals first, because we also need to reach out to adults, youth and young adults, community leaders. As I mentioned, we really want to focus on community leaders to let them know that they're able to make a difference in the community. And then our primary focus on populations most affected by COVID-19, since we are using those COVID funds, and those who have experienced, the greatest health disparities that have been exacerbated by COVID. So a little background on how we developed this campaign. So we started working with UT in 2021 to do research on our target population. And so UT was able to do a survey of Texans, that reflects the diversity of Texans across all ages, genders, and geographic location. UT also participated or held some focus groups that our target population participated in. And so by combining the findings of the focus groups, academic literature reviews, an environmental scan, and the survey, we really came to the conclusion that what matters most to Texans are these top 5 things: their family, happiness, physical health, religion and spirituality, and mental health. And so it's important for us to know these things so we know kind of what areas to target for the media campaign. In addition, the participants who participated in our survey really reported a relatively average level of stress, but they said that they often believe that people are, going to substances to reduce stress or relax or just forget about their worries. We also kind of, from that, that shows that typically there are, social norms showing that that is something that people think that other people are doing, that they're turning to substances to kind of relieve stress or maybe relieve symptoms of the mental health struggles they're feeling. So another thing that we really wanted to target with this campaign is social connection. That's something we really saw was lost during COVID. CDC they've done a lot of work and done some surveys that have showed that really post-COVID, one of the things that we should be targeting to kind of address mental health and reduce substance use is social connection, because that is a really big protective factor for substance use. So, like I said, based on all of this research that our vendor UT did, we kind of came up with some potential themes for research. So the potential messages that we wanted to kind of put out there and work to create content for are: reach out to somebody, you're not the only one who feels this way, start a conversation with someone you care about, take back control. And we also really wanted to promote the message of the connection between physical and mental health. So based on the campaign or based on that research, we came up with the concept of turn to. So the turn to concept is really kind of saying when times are rough, where do you turn to? If you don't know 2 years ago, you know now. We really want to empower Texans to turn things around and turn to people and places that lead to happier and healthier lives. We're really hoping to help Texans understand and recognize the symptoms of isolation and loneliness that affect their well-being and how they can contribute to substance use. We really want to give people the necessary tools and resources for reconnection. We want them to also feel empowered to make healthier choices, and hopefully as a result, we'll have, higher resilience and be better equipped to overcome loneliness and break free of of current or maybe potential substance use, and hopefully, impact people's physical and mental health to lead to a healthier and more emotionally fulfilled life. And so that's kind of where this turn to concept came from. And so that's really the theme of the campaign is turn to. Our campaign website is turn2supportstx.org. We also have started running ads with a turn to hashtag. So since our providers, well, before I say this, I'm going to show some of the assets to you all so you can see kind of what we've created with this. But I did want to kind of give a plug. All of our providers that Sachin mentioned, like I said, are required to promote our statewide media content. And so they'll be promoting it with the hashtag turn to. So if you see that hashtag and you're part of an organization, feel free to share the message. So I'm going to start by showing some of our out of home assets. Here we have some digital ads. We're also doing ads on buses. I saw one the other day, which was very exciting, one of our turn to ads. And then we also are doing billboards and, other out of home venues like places where people congregate, community centers, shelters, just places like that. And so we're really kind of telling people there are other places to turn to. There are people to turn to. There are conversations to turn to. You have your pets to turn to. You have fresh air. There are parks. There are friends. There's your community. So this is kind of showing how we've operationalized the turn to concept. Here's some of our social media assets that our providers are posting. Just saying, your feelings matter, make good connections, recognize how you're feeling, and kind of pushing people to the call to action is to go to our turn to website or to, talk to somebody, turn to somebody, reach out. Here's some of our digital ads. These ads right now have stock images, but they will be replaced with original photography. And this ad is animated, so it kind of has the turn to arrow. We're really using the arrow to show people who and what they can turn to. So these ads are, like I said, targeted digital ads that'll pop up on a matter of websites, based on people's information and kind of based on our target audience. So the next slide I'm going to show you is one of our PSAs. And this PSA has been sent to, channels, but it's not live yet in market. But this PSA is aimed at youth and young adults. I'm really hoping that everyone can hear this. So let me know if you're unable to hear it when I share.
Can't hear.
Yeah, we can't
Oh,
hear
no.
it clear. Did you by chance click the two boxes at the bottom before you shared?
I did not. Should I reshare?
Yeah, go ahead and do that.
Okay.
It should be two boxes about share computers now.
Okay. Hopefully I'll start it over and let me know if you're able to hear it this time.
I can't move.
Are we able to hear it?
Yes, ma'am.
Perfect. Okay, I'm gonna start it over.
I can't move. No one wants me. They're too busy to care. Why should I even bother?
Hey, you feeling all right?
Whether you know it or not, there's someone in your life who's there to listen and can understand what you're going through. We don't have to face hard times alone. So when you're ready, open up. Find out more about yourself and what you can turn to. Visit turn2supportstx.org.
So very excited about that PSA, hoping that everyone, comes soon, we'll see it. So look out for it. We also have a PSA aimed at adults and then one aimed at community leaders. So the final thing for the campaign I'm going to touch on is our check-in. So another call to action, in addition to having someone turn to the people they know, is to also go to what we're calling check-in. The check-in is essentially a quiz. And this quiz will kind of go through different risk and protective factors, and we'll have people identify how they're feeling, what resources they're in need of, maybe if they've identified substance use, and we'll provide resources based on what they select. And so these are some of the ads for our check-in. The check-in is still in development, but I wanted to give you all a sneak peek. So hopefully these ads will be running later this winter in February, but there are kind of two parts to the campaign. So I'll go ahead and turn it back over to Sachin to keep talking about our programs.
Thanks, Claire. So the next slide, so when it pops up, sorry. Oh, there we go. So the Texas prevention training. So I'm going to kind of speed through these next couple of slides because I know in the interest of time, we're running out of time, but our TPT is basically our training entity, which basically certifies the prevention workforce and delivers trainings to make sure the prevention workforce is, competent in certain curriculum. There's trainings and, there's various trainings. So basically it's here to basically make sure that they keep providers up to date with trainings. They also help us with having several conferences that we host, the annual prevention providers meeting and the directors meeting, and they're here to help basically any training and technical assistance needs that we require. Next slide, please. Now that website, texaspreventiontraining.org, please write that website down because I would like everybody in the audience to go to that site. There's a place on that site where you see provider directory. This is where you can go and see, hey, what are the YP folks in my area? What are the CC? What are the coalitions? What's the PRC? That basically contact information for our program. So if you have a question on that, please go to that site and get familiar because I feel like that will be really beneficial to you all. Next slide, please. Okay, our coalition projects. I know we talked about this earlier. So so basically the coalition projects, we want to enhance behavioral health and wellness. We want to implement stress reduction and trauma healing healing. We also wanted to expand our tobacco efforts at the state because COVID has impacted substance use as far as substance use and behavioral health, of course. So we did some initiatives pertaining to COVID, but I did want to read something. We got a letter, actually an email from somebody who benefited from this project that I did want to share real quick, if I have time. So this is from somebody who received these services. I don't know how many of you felt the ground shake beneath your feet during COVID-19 or felt the bottom drop out, but it rocked our world. Circumstances and income changed drastically. I had to make the quick decision to move us to a itty bitty house where I had to share a bathroom with both boys. I've been working my butt off to make ends meet for 2 exhausting years. And then there was a point that I hope was my lowest, the point where my savings was drained and my credit card was in danger. That point where I kept having to choose just a few from the never-ending costs: food, rent, gas, or bills. I'm praying over and over our situation and researching options. I did find 2 amazing resources. Around February and March timeframe, I began working with these 2 blessings that are now a part of our story: the Alamo Resource Conservation and Development's Growing Rural Program, and Cicada gave Evan and I 2 garden beds in the local community garden. All of the knowledge, skills, seeds, and supplies we needed to grow our own food. Evan put in a bunch of work, pulling grass and weeds, applying fertilizer, planting the veggies, and stomping squash bugs. I'm doing all of the maintaining. I drop by every evening during my walk to water. We'll stop in a couple times a week to harvest veggies. And now there's extra healthy homegrown food on our plates that I didn't have to struggle to pay for. I'm so grateful for these 2 programs and everyone that donates or volunteers to keep them going. Thank you for helping us while we're in need. I did want to read that because I felt that really touched my heart, because it's really important, because we often deliver services and we never get to see the results of it. So I did want to definitely share that because it did touch everybody on everybody's heart on the team. And the final slide I did want to share is the impact of our reach last year. So here there's a bunch of numbers. You'll see that there's 70,000 plus youth receive prevention education training. You'll see 460,000 youth receive knowledge from presentations. So this is a bunch of numbers of our reach. I did want to share, if this still we have time. I know we're pressing up on time, but I did want to share some examples. I know we talked about alternatives. We did have some providers. We had Abilene Recovery Council. They worked with De Leon Elementary, where they had a Candyland theme course for children to go through. We have a DPR, Drug Prevention Resources in Region 3. They did several alternate activities at Harmony Middle School in Dallas County, where they made holiday cards for military personnel. Isleta del Sur Pueblo facilitated a week-long Red Ribbon Week celebration, including a block party, parade, pumpkin painting, and trick or trunk activities on the Pueblo to empower youth and adult tribal citizens. I did want to point that out because a lot of these providers are out in the community and they want to help. So I wanted to make sure we're all informed of a lot of the work that is done here at the state, especially in prevention. I know we're just about at the end of time. There was a lot in this presentation. You please reach out to me because if you have any questions, or if you have any questions now, we can field them, but I'm sure there's a lot of questions in the chat. I haven't been looking at the chat, but please reach out to either Claire or myself, and we can definitely answer your questions or get someone who can answer them. So thank you for listening to our presentation.
Thank you so much.
Yes, thank you so much for your wonderful presentation. Just to summarize the majority of the questions, and I know that you have already, you and Claire have addressed this, but just to make sure everyone understands, the majority of the questions were asking about, how do we find specific providers that will come into our school district? So I know you mentioned that, but if you don't mind mentioning it just one more time so that everyone can fully understand.
Yeah, you can either go to that website, prevention training, that was posted, texaspreventiontraining.org, and go to that provider resource directory, or you can even email me and just say, hey, I'm in Houston, and I work for this school, and we're wondering if there's any, and I can definitely help you out with that. I can definitely, absolutely, because I feel like there's a lot of prevention providers that want to go into these schools, and oftentimes I hear about, from the schools where they talk about, oh, we want to prioritize, low test scores, and we I don't know if we have time for prevention curriculum, but if you really think about it, the low test scores, maybe they're getting low test scores because of behavioral health issues, or their turn to substances. So there's a lot of tie-in. I feel like there's a lot of overlap, and I feel like prevention services can be beneficial, especially for this school. So I did want to emphasize that also.
Thank you so much to both of you. And, these are free resources too from our partners at HHSC, which is very, very important for schools. I noted, you shared so many links, and I already started looking at some of the websites to take deeper dives to learn how to access. Building relationships and partnering is one of the tenets in our school mental health framework that TEA has published. All of the substance abuse prevention, mental health prevention fits totally what you talked about today as tier 1 strategies. And when we have good, solid, a tier 1 that builds these good social and emotional and behavioral and good decision-making skills at that level. And I heard you talk about at families. Some of these workshops can be done for families, and that is so important. I know some of our school districts have brought the prevention resource centers into the schools in the evening. In the day, they've done some virtual, some live, some hybrid, some amazing things with the prevention resource centers for families to create the awareness. And that includes on the fentanyl issue for prevention that you all are working on as well with us, because these are very much real concerns to parents out there. So we deeply appreciate the depth of what you have. And, you just got to kind of get started one foot before the other. The people that are on this webinar for schools that I've been seeing join are the people out there trying to make things happen. So this is perfect that we can make this connection with you all at HHSC so that people can take that deeper dive. Now, I'd like to ask everyone, If we could, did we learn something today? For SAMHSA, we really need you to just click on this link and answer the 4 little questions. It's linked to your pretest code that you took. So UT will get that and just aggregate. Let us know if this webinar was beneficial to you all. I think there's also an opportunity for you to leave some comments on anything else that you would like to learn or other deeper dives you'd like us to take with this group or others. Dr. Campbell, are you trying to say something?
Yeah, sorry, one last thing. Thank you to the audience again. And I just wanted to just, give a shout out to y'all for attending this. I also wanted to say, please, there's a lot of social media, like organizations have social media pages, YP, PRC, CCP, they have social media pages. Go on their pages, like their posts, get involved, get engaged, because I feel like there's a lot of content out there, because this is only 1 hour. There's so much more to be discussed and learn. So like go to these pages and learn what they're doing out in the community. So I just wanted to emphasize that.
Repost anything with the turn 2 hashtag.
Okay, thank you so much. And I believe that Ashton is going to drop in a couple other links and resources that we have at TEA that we just want to make sure that you're adding to your bookmarks and your resource links. So Ashton's going to drop in a fentanyl awareness that links to all the HHSC programs as well, and some national and SAMHSA resources that the agencies worked on together. TEA worked on the link that Ashton's going to drop in together with HHSC. So there's some aggregated additional resources, not all the ones that you got from Dr. Campbell and Claire today, but some more. So go ahead and grab that link if you would like, so that you just can continue to build your resource knowledge and database. Also TEA with our communications division and leadership developed this toolkit, communications toolkit for TEA that we sent out to every school district in the state. From our safe and supportive schools and discipline. You can click on that link to find some sample letters, to invite parents to sessions, to inform them about the importance of this substance use prevention work that we're doing, some social media from TEA that schools may be able to use, and things like this in our joint work together. So it is 11:58. I want to just remind us all to just please take a second to do that survey before you leave, and to remind you, if you're here to the end of the session, that you will be getting that 1 hour CPE for this substance use and misuse training and all of these resources. They shared their contact information. That was very gracious, Claire and Dr. Campbell, with you. And so if we can just all stay in communication and be gathering and keep the conversation going, this is a great, wonderful start. We really hope you'll register for every series. We are confirming the final presenters for each section, trying to give you at least a broadest in-depth look at some of the resources and knowledge that we want to make sure everybody has in our schools and our state and our partners who you're working with. So thank you. I think we're about ready to wrap up unless anybody had any last minute comments. Panelists, Ashton, Tammy, my partners, Dr. Campbell, Claire, we've got 1 minute left. Anyone have anything else for the good of the order? Okay, well, thank you. We give you 1 minute back. Thank you for filling out the survey, for being here. We'll see you next month on the second Wednesday of the month for a webinar series, Mental Health, Behavioral Health 2. Thank you. Have a beautiful day and Happy New Year.
Thanks, everybody.
Thank you.
I will leave the room open just in case any folks need to do their post survey, but you all are definitely free to go. I'll leave it open for a couple of more minutes for the post survey.
Thank you, Ashton.
Okay, I'm gonna leave. Thanks again.
Bye.